Hello guys, so next moving on to the second part of the video, that is antimicrobial use and components of antimicrobial stewardship. Antimicrobial resistance is a global threat today and has overshadowed the potential gain in reducing death due to infection. It is estimated that by the year 2050, Asia will have 4.7 million deaths that could be directly attributing to antimicrobial resistance. India is the largest consumer of antimicrobials in the world, that is 13 billion standard units in 2010, and from 2000 to 2010 the per capita consumption has increased to 66%. Moving on to the objective of antimicrobial use guidelines. It mainly concentrates to improve the awareness and understanding of antimicrobial resistance, to strengthen surveillance and research, to reduce the incidence of infection, to optimize the use of antimicrobials, to ensure sustainable investment in countering antimicrobial resistance. Antimicrobial Stewardship Program implements rational antibiotic use to overcome irrational antibiotic use. Antimicrobial stewardship is defined as a set of coordinated interventions designed to measure and improve the appropriate use of antibiotics by promoting the selection of optimal choice, dose, duration, and route of administration of this antibiotic, which in turn leads to improved patient outcome and decreased adverse effects. Antibiotic use can be prophylactic, that is, it can be used to prevent infection. It can be preemptive, that is, used to abort the infection. It can be empirical, used to provide initial control of the infection in the absence of knowledge of its etiology. Here you don't know what is the exact organism. Next, it might be definitive. It is used for definitely curing the infection, and here we know the etiology also. So this choice of antibiotics will depend on the site of infection and likelihood of antibiotic resistance. Let us move on to essential elements of antimicrobial stewardship. It mainly includes prospective audit with intervention and feedback, formulary restriction or pre-authorization, educating the physician on rational use of antibiotics, optimizing dosing and route of administration, de-escalation and decrease in unnecessary combination therapy, early switching from IV to oral route of administration, appropriate duration of antibiotic therapy, regular antimicrobial consumption measure, implementation of site-specific treatment based on clinical guidelines. About all the core elements we will be learning in the next video.